Well, we've always said that there will be infections in the schools. It's inevitable given the reality of the viral spread. And that's why we've put in place a number of protocols based on the scientific advice of our Chief Medical Officer of Health in consultation with superintendents and school boards. We believe it's a strong plan, and we'll make future adjustments as necessary. We're all learning through this as we go. One thing I will underscore is that Dr. Hinshaw and her team, they did not come up with our guidelines arbitrarily or based on mere opinion. They did it based on a very close reading of the most up-to-date research and data coming from jurisdictions that have opened their schools. And that's what's informed their approach. And let me say that we would ask that school boards remember to please consult with the Alberta Health, with the Chief Medical Officer, on responding to positive cases or outbreaks. And she is going to look at each one of those on a case-by-case basis and make the appropriate judgment. So it's always been clear that there would be some outbreaks, and from time to time there will be classes or even schools that have to suspend operation for a while, but that should not the inevitability of that should not be a reason for us indefinitely to keep the schools closed. The colleges of pediatricians in both Canada and the United States, the associations, I should say, of pediatricians have been very clear that there are very significant negative health consequences and other consequences for kids if they cannot return to in-class instruction, including mental health challenges. And so I think it's essential that we get the schools open, assuming obviously a certain risk. As the College of Alberta School Superintendents has said, the reopening plan of Alberta Education clearly demonstrates a willingness to take the necessary steps to support the safety of staff and students, and they appreciate our continued collaboration and support. The president of the College of School Superintendents also said that they strongly believe that the reentry plan offers the appropriate balance of guidance from the Chief Medical Officer of Health and the government, while providing for the authority and autonomy for individual school divisions to assure their students, parents, and staff that a successful return to school will be safe. As Dr. Hinshaw herself said, as a parent of school-aged children, I've decided that the value of in-school learning outweighs the risks for my family, and that's why I'm sending my children back to school in September, as she said last week. So we'll continue to modify the protocols for the schools based on the scientific advice that we receive from the Chief Medical Officer.